Welcome to our virtual event, COVID-19 and Your Workplace. Thank you for joining us. My name is Michael Pogorzellik. My background is in pharmacology and microbiology. I'm a certified health and safety consultant and work as a prevention consultant at SafeWork Manitoba.
Hi Mike, great to see you. My name is Jennifer Dick. My background is in nursing. I'm a certified occupational health nurse and prevention consultant with SafeWork Manitoba. SafeWork Manitoba is a division of the Workers' Compensation Board and is the public agency dedicated to the prevention of workplace injury and illness. Working with our partners in the safety community, we provide prevention education, safety programming, consulting, and strategic direction to create a genuine culture of safety for all Manitobans.
We'd like to go over a few housekeeping items. In an effort to ensure we comply with public health COVID-19 protocols, including physical distancing, Jen and I are presenting from our own homes. Some of this presentation has been pre-recorded to ensure we are able to deliver clear information. Some of the information may have changed since we recorded this session. There will be some live portions, including polls, where we ask for your participation. Please use the Q&A box if you have any questions or technical issues during this presentation. We will do our best to respond throughout. If we are unable to give you an accurate response right away, following this presentation, we will compile all questions, take the time to research the answers, and post responses to our website. We will notify you when they are up. The recording of this presentation will be posted at a later date on the SafeWork Manitoba YouTube channel. It is also important to note this presentation is not a substitute for legal or health advice and should not be relied on as such. Viewers should seek their own legal and health advice or follow workplace procedures.
The goal of today is to bring you some really important information around COVID-19 in the workplace. Our focus is going to be on the fundamentals of preventing the spread of COVID-19 and try to make sense of the pandemic by gaining an understanding of the important roles and responsibilities of everyone at the workplace. We will frame this by talking about what is COVID-19, talk about the fundamentals of prevention, and understand the roles and responsibilities. We'll also share several resources.
To get things started, let's start with a poll. The question is, what is the difference between SARS-CoV-2 and COVID-19?
Thank you for your participation in the poll. This is a very interesting question. The answer is B. SARS-CoV-2 is a virus that causes COVID-19. These terms are often used interchangeably, and these terms will be used today. The following slides will further discuss the differences.
Thanks, Jen. Let's start with talking about what is SARS-CoV-2, the virus that causes COVID-19. SARS-CoV-2 is a novel virus and stands for Severe Acute Respiratory Syndrome Coronavirus 2. It is invisible to the human eye, however it can be visualized using a powerful microscope. A recreated image of the virus can be seen in this picture. As you can see, it has an outer shell with crown-like spikes. Viruses belonging to this family start with corona, which in Latin means crown. These spikes help facilitate virus entry into human lung cells, which is required for its replication and survival.
That's really interesting, Mike. As we can see, it's really important to understand what a virus is, and that it's really the SARS-CoV-2 virus that causes COVID-19. We've definitely heard some new terms throughout the pandemic: novel or new, zoonotic, which means that the virus came from an animal, and human-to-human transmission, meaning that the virus is passed between humans. Because the virus is new, humans have no immunity. We also know there is currently no therapeutic treatment or vaccine for COVID-19. It has also been reported that an estimated 40% of people may transmit the virus asymptomatically, or have the virus in their body but no symptoms. Or pre-symptomatically, they have the virus in the body but not showing symptoms yet. To continue to interrupt the transmission of SARS-CoV-2, we need to be diligent with practicing prevention measures and understand how COVID-19 is spread.
To follow public health guidance, it is important to understand how SARS-CoV-2 is spread. SARS-CoV-2 is primarily spread through direct contact, droplet transmission, and indirect contact. We will now watch 3 videos from Public Health Ontario that summarize these 3 transmission mechanisms. Direct contact occurs when an infected person transmits the virus to a healthy person via direct physical contact. In this first video, we'll see an example of direct contact where an infected individual shakes hands with a healthy individual. Next is droplet transmission. Droplet transmission occurs when an infected individual is in close contact, less than 2 meters or 6 feet, with a healthy person. In this video, we'll see an example of droplet transmission when the infected individual coughs or sneezes on a healthy individual. Finally, there is indirect contact. Indirect contact occurs when infectious droplets contaminate the surface of objects. This is followed by a healthy person coming into contact with these contaminated surfaces and then proceeding to touch their eyes, nose, or mouth. In this last video, we'll see an example of indirect contact where a healthy individual comes into contact with a contaminated surface. It is important to note the closer and longer you are in contact with an infected individual, the higher the risk of transmission. Due to recent developments since the recording of this presentation on how COVID-19 is spread, please see the Government of Canada website.
We can see how easily we can transmit this virus. It might be from an innocent handshake or a sneeze. I think we can all agree that there are some fundamentals that have been provided to Manitobans over the last 6 months. We have seen how we can effectively limit the spread of SARS-CoV-2 by following prevention measures outlined by public health experts. We know that effective hand hygiene, following cough etiquette, and physically distancing work to prevent the spread of COVID-19. We also know that we must stay home if we are sick to prevent any virus from spreading within the workplace. A recent research article published by the Institute for Work and Health reported that infection control practices may be an important factor to reducing the transmission of COVID-19 in the workplace.
Our next poll asks the question, in Manitoba, do workplaces have a legal responsibility to ensure the safety and health of employees?
Thank you again for your responses. The answer is A, yes, they do. We will now take a look at those important responsibilities in the following slides.
It is important to realize that viruses are not new to the workplace. For example, workplaces have had to implement prevention measures to deal with the impact of seasonal influenza on their operations at least once a year. The influence of COVID-19 has simply made us more aware of these virus prevention measures in the workplace. It is important for workplaces to develop and implement the appropriate COVID-19 prevention measures to keep workers safe during this pandemic. To accomplish this, workplaces must adhere to legislation from the Manitoba Workplace Safety and Health Act, the Manitoba Public Health Act, and the Human Rights Code.
To begin, let's talk about legislation. The employer has a very significant role to play when it comes to keeping employees safe and healthy. Not only do they need to ensure they are following the prevention measures as set out by the Chief Public Health Officer and the Public Health Act, but they also need to ensure the workplace safety and health legislation continues to be adhered to. This not only means preventing injuries in the physical sense, but also preventing the spread of COVID-19. There are 2 parts of the Manitoba Workplace Safety and Health legislation that we'd like to bring to your attention today. Part 2, which speaks to the general safety duties, as well as Part 36, which is specific to chemical and biological hazards. These parts address workplace hazards and what needs to be done to keep workers safe and healthy. These address the need for assessment, controls and safe work procedures, training, and follow-up. Part 39, healthcare facilities, is specific to healthcare and would be applicable in healthcare settings.
The employer also has a duty to follow the Manitoba Human Rights Code, which protects individuals from discrimination if they have a disability, including an illness or medical condition. In other words, the employer is required to attempt to find suitable, accommodated work for an employee that tests positive for COVID-19 or is showing symptoms of COVID-19 up to the point of undue hardship. The Manitoba Human Rights Commission reports that potential accommodations can include allowing employees to work from home where feasible, permitting employees to work alternate hours, allowing employees to take leaves from work, or other flexible options. It is important to note that each situation is different, and what that means in the context of COVID-19 will vary depending on the workplace. Therefore, it is recommended that the workplace seek legal advice to determine how to best comply with their human rights requirements. As a reminder, this is not legal advice, nor will it be appropriate for any particular circumstance. For additional information on this topic, check out the Manitoba Human Rights website.
We have also heard a lot about the Public Health Act. The Public Health Act allows the Chief Public Health Officer to pass special measures to ensure the health and safety of Manitobans. This allows him or her to work closely with government officials and close businesses or put stipulations in place to ensure everyone is safe. We have seen how some measures within the Public Health Act have been enforced. The face of the COVID-19 pandemic has really been Manitoba's Chief Public Health Officer, Dr. Brent Roussin. We have seen how the Public Health Act has been enacted in an effort to keep Manitobans safe. We will start our discussion on the role of public health. The role of public health has really been to keep Manitobans informed and provide details on how best to keep Manitobans safe. The Manitoba Chief Public Health Officer's role is to provide timely and current information to all Manitobans. We will see this on the Manitoba Health website in the form of bulletins, news releases, stats, and additional materials. Public health provides information to the employer on what they need to do to keep employees safe. However, individual workplaces should complete a risk assessment to fully understand where the hazards are and how to ensure the fundamentals of prevention are able to be followed.
Some Manitobans are uneasy about returning to their workplaces. We can reduce our risk and limit the spread of this virus by taking recommended precautions and practicing safe work. We need to get used to a new normal until a vaccine is found, including social distancing where possible, practicing good hand hygiene, sanitizing commonly used surfaces, and staying home when you're ill, even if you only feel a little unwell. It's going to be different, but we'll get through this together.
Here's our final poll. Who has a responsibility to keep everyone safe in the workplace?
This is a great question because we all have a responsibility. The answer to this is E, all, and is the basis for the following information. Thank you again for participating.
Just as Manitoba Public Health has a responsibility to the public, the employer has the responsibility to their workplace. The Manitoba Health website provides detailed information for the employer. The employer needs to understand the prevention measures around COVID-19, enforce these measures, and lead by example. This includes physical distancing, following cough etiquette, and staying home when sick. The employer should continue to reassess the situation as new information is identified and change the plans as needed.
At the time of this presentation, Manitoba Health has provided the following information for workplaces. Many of them fall to the employer to address. As we see with legislation, the employer has a duty to ensure employees' health and safety. A virus, although invisible, is a hazard that the employer has to address. Manitoba Public Health recommends an infection prevention and control plan. This plan may incorporate what the workplaces will do around cleaning and disinfection and prevention measures that are put in place. Cleaning and disinfecting may look different to each and every person in the workplace. The employer may consider incorporating when to clean or disinfect and may even consider adding cleaning and disinfecting to procedures such as use of meeting rooms and the processes to follow. The employer is also responsible for putting on prevention measures to keep workers safe. This might include signage, floor stickers for one-directional traffic, and limiting the number of staff in certain areas such as the kitchen.
Ventilation has been a really important topic that has been talked about for workplaces. Making sure that ventilation systems are in good working condition and operating effectively, and weather permitting, have doors or windows open to promote air exchanges. There's a new CSA guideline that speaks to return to operations and has a component that speaks to ventilation. Workplaces should also have a plan should someone become ill while at work. If a worker becomes symptomatic, what do? Who do they talk to? And where do they go? These are all factors that should be considered as a prevention measure.
There has been a lot of discussion around the use of PPE in workplaces. Personal protective equipment such as N95s or gloves may be used in some workplaces. N95s should be reserved for workers in healthcare or other industries where required and/or they have already been using. The intent is to keep the PPE in the workplaces that are already using it. However, if non-medical masks are being used in the workplace, it is important for the employer to train to the proper fit, use, and care of a non-medical mask. Employers may also consider providing masks to employees if it is a requirement for employees to wear a non-medical mask. Employers should also consider communication around stigma and bullying when employees may not be able to wear a mask because of medical or other reasons.
As mentioned previously, the employer also needs to maintain effective leadership during this pandemic. This includes embracing the safety agenda and maintaining or shifting the safety culture in a way where everyone in the workplace is doing their part to keep each other safe. The employer also needs to, in collaboration with the Workplace Safety and Health Committee, develop COVID-19 safe work procedures. This would include adjusting work processes to reduce the risk of worker exposure. For example, utilizing sneeze guards in areas where staff are frequently engaging with customers. The employer must ensure that policies and procedures reflect Manitoba Public Health COVID-19 recommendations, in addition to keeping open communication with their employees. This includes if and when the company is returning to operation, part-time versus full-time, and the steps the company will be taking as outlined in their pandemic plan.
The pandemic plan outlines what will happen should a pandemic occur. This would include whether staff can work from home and practices workers must follow. It is also a role of the employer to ensure privacy and confidentiality. This would include what will happen should an employee become sick at work or have to isolate because of a positive COVID-19 diagnosis. What will happen should there be a diagnosed worker? Although workers might ask several questions, the employer must maintain confidentiality to the extent required by privacy legislation. The employer not only has a responsibility to understand how to prevent the spread of COVID-19, but also needs to lead by example and enforce the new rules. The employer must continue to reassess the situation and change the plans as needed when new information is identified. When leaders lead by example, it sets a positive culture that will extend within the workplace.
Finally, the employer is responsible for accommodating the disability of a worker up to the point of undue hardship, as we previously discussed. The employer should also provide or direct employees to mental health supports and resources during this unprecedented time.
Several local resources are currently available to all Manitobans. The province of Manitoba has an online course called Ability CBT, which allows Manitobans to work through a series of modules and integrate a cognitive behavioral model approach to dealing with feelings around COVID-19 and our mental health. Check out the link in the resources section for more information. Several Manitoba resources are also offering virtual counseling, such as Workplace Employee Assistance Programs or Clinic Community Health Center. These resources can be accessed via your own Workplace Human Resources or check out their websites for further information. If it's within your belief system, spiritual leaders were offering virtual appointments as well.
Next, we will talk about the role of the supervisor. The supervisor plays a pivotal role in keeping workers safe during this pandemic. The supervisor needs to understand the risk of COVID-19 in the workplace and be familiar with the employer's health and safety protocols. This includes being familiar with the employer's infection prevention and control plan and any other policies or programs around COVID-19 in the workplace. Like the employer, the supervisor needs to lead by example, maintaining physical distancing, hand hygiene, cough etiquette, and use of controls as appropriate, in addition to maintaining confidentiality when dealing with an employee with a potential COVID diagnosis or exposure.
The supervisor is also in a great position to answer questions that might be coming from workers. The supervisor can communicate these effectively to management and to workers. Having an open communication and allowing for all concerns to be addressed not only can help settle anxieties, but also give everyone a voice to be heard. As Mike mentioned, supervisors should lead by example, and this also includes the use of PPE. When in a workplace that requires hearing protection, if the supervisor is wearing earplugs, it leads by example and shows employees how important PPE is. When a supervisor models behavior, it shows workers that it is important and their health and safety is paramount. It is also extremely important for supervisors to be aware of mental health supports. Supervisors typically see workers during their shift. The pandemic has created an environment where we might be distanced, but it hasn't taken away the need for compassion and empathy. A supervisor who checks in with workers will notice behavioral changes or open a door for a worker to talk. It's important for supervisors to ensure privacy of information, but also know about those available resources. Supervisors can help by promoting a worker in getting help and talking to someone.
Employers and supervisors have the ability to enforce the rules, but what's also really important to keeping our workplaces healthy and safe is the role of the employee. Employees have a role to follow the prevention measures and safe work practices as directed by their employer. The employee should understand the COVID-19 hazard and follow the workplace COVID-19 prevention measures. This would include using the appropriate PPE when required, washing hands, covering cough, physical distancing, and staying home when sick. This might also include doing the self-assessment before going to work. It is also important for the employee to ask questions and stay informed. The information on COVID-19 is constantly changing and being updated.
It is also an important role to be aware of your own mental health and reach out if you feel that you are struggling. Your employer and supervisor should be aware of the mental health resources and will help. The employee also has a role to understand and report any incidents or unsafe acts. Employees are in a great position to provide feedback on a process and report anything that doesn't seem right or is unsafe. The employee can report to the supervisor and to the Workplace Safety and Health Committee or representative, depending on the size of the workplace. In a unionized work environment, workers may wish to consult their union.
Finally, we're going to talk about the role of the Workplace Safety and Health Committee or representative. Depending on the size of your workplace, you may have a Workplace Safety and Health Committee, representative, or neither. We know that the process to bringing up a concern starts with the supervisor. If it's not resolved, it goes to the committee or representative and further to Workplace Safety and Health if no resolution. The role of the committee or representative is to support the workplace in preventing the spread of SARS-CoV-2. The committee or representative should have the knowledge and understanding of COVID-19 to provide to workers or be aware of resources to direct workers to the appropriate information. This may include holding COVID-19 toolbox talks and safety swaps. The committee or representative must review and be aware of COVID-19 workplace policies and procedures. This includes the infection control program and ensure they are reviewing workplace policies and procedures in collaboration with the employer. Committee members or representatives also need to be the example. Physical distancing, cough etiquette, hand hygiene, and stay home when sick.
We know that inspections are done regularly, at minimum of quarterly. SafeWork Manitoba asked a safety expert this very question. Itoro Afia, prevention consultant with SafeWork Manitoba, talked about adding hand hygiene and cleaning procedures to the committee inspection checklist. We've said this all along, dealing with viruses in the workplace is not new. But COVID-19 has addressed the need to make sure we are practicing effective hand hygiene and coughing into a sleeve or tissue. The committee or representative can bring attention to these fundamentals and even recommend that more training or awareness may be needed. The committee or representative is also involved in incident investigations. One of the investigations a committee member or representative is a part of is the right to refuse. Mike, can you explain what this might look like for someone in the workplace?
Sure, Jen. So employees and employers have rights and obligations under the Manitoba Workplace Safety and Health Act for workers' health and safety on the job. This act gives a worker the right to refuse work that they believe is unsafe for them or another worker. There is a legal process that work refusals must follow. In addition, workplaces with collective agreements in place may have additional steps or requirements. The role of the committee or representative is to investigate work refusals if the worker and the supervisor cannot resolve the issue on their own. A worker member from the committee or representative can be brought in to help assess the situation and attempt to resolve the issue. Manitoba Health and Workplace Safety and Health outline the process and important questions the committee member or representative should consider when addressing work refusals related to COVID-19. These include, has someone in the workplace been confirmed to have the virus or is symptomatic? Is the workplace a high-risk source for the virus? Is the refusing worker likely to be exposed to the virus while performing the work? Does the worker have a pre-existing medical condition that places them at increased risk of a serious illness should they be exposed to the virus? Based on these questions, if the risk of exposure is determined to be high, the committee member or representative needs to determine if the employer has an infection control plan in place with adequate control measures. This includes hand washing or sanitization facilities, appropriate PPE if required, and appropriate training on infection control practices. For a detailed step-by-step process on how to respond to work refusals around COVID-19, see the link on the Safe Work Manitoba website.
To summarize what we have talked about today, we have reviewed SARS-CoV-2, which is a virus that causes COVID-19, the disease. We also discussed how SARS-CoV-2 is transmitted and covered prevention fundamentals. We highlighted the pertinent legislation and talked about the Manitoba Workplace Safety and Health Act, Manitoba Public Health Act, and the Manitoba Human Rights Code. Finally, we highlighted the roles and responsibilities of the employer, supervisor, worker, and health and safety committee or representative in keeping each other safe during this pandemic. These actions were in place when recording occurred. As such, some information may have changed. Check out the most recent information and orders on the Manitoba Health website.
At this time, we would like to stop and answer some very important questions that we have heard about. If you have any additional questions, please do not hesitate to contact Jen or I. Our contact information will be posted at the end of this presentation.
Mike, one question that has been asked or commented on many times throughout the pandemic is that it is just another flu. Can you answer this question? Why is COVID-19 different than influenza?
Sure, Jen. You may have heard people saying that COVID-19 is just another flu. However, though they do share some similarities, there are distinct differences. It is important to note that SARS-CoV-2 has unique characteristics even among the family of viruses it belongs to. Here we will focus on comparing COVID-19 and the flu. Both COVID-19 and the flu cause respiratory disease and spread in the same way. Human-to-human transmission via small droplets of fluid from the nose and mouth of someone who is sick. Both can be spread before showing symptoms and both produce similar symptoms. Therefore, it may be hard to tell the difference between influenza and COVID-19 based on symptoms alone. This is why testing is important to confirm diagnosis. Noted differences between COVID-19 and the flu include the following. SARS-CoV-2 is less easily spread compared to the flu. There is no vaccine or treatment for SARS-CoV-2, whereas for the flu we have an annual vaccine and therapeutics. We currently do not have immunity to this novel virus, whereas with seasonal flu we do. We need to conduct containment practices and contact tracing to save lives with SARS-CoV-2, whereas with the flu we do not. Finally, SARS-CoV-2 has a longer incubation period compared to seasonal flu. Incubation period refers to the time at which someone contracts the virus to the time in which they show symptoms.
Another great question we had was, what happens if there is a COVID-19 laboratory diagnosis in my workplace?
A public health investigation is automatically triggered when someone receives a laboratory confirmed positive COVID-19 test result. Anyone diagnosed with COVID-19 is advised to self-isolate at home for 14 days from when their symptoms started. Individuals who require medical care are treated in hospital. Public health notifies close contacts of laboratory confirmed positive COVID-19 cases. Anyone at risk of contracting the virus from a coworker will be notified by public health. Public health will notify the workplace directly and provide advice.
Mike, is there something the supervisor can do to protect the workers in the workplace?
It is important for the supervisor to stay in regular contact with the employee. Make any required modified work arrangements. Enhance cleaning in the workplace and confirm the employee's fitness for work before allowing the employee to return to work. Public health, again, will contact the supervisor if there's a need to take action in the workplace. And Jen, did you know that it is also important for the confirmed worker, if at home, to remain at home? If at work, the worker should leave work immediately. They should notify their manager and self-isolate at home for 14 days after the start of symptoms. Work with public health officials as needed and contact health links and update management as required. No one should be at work if they are ill. If an employee is ill at work, showing or having a cough, runny nose, fever, or sore throat, they should go home immediately. Employees, managers, and employers should also follow any appropriate occupational health and safety protocols. If a worker is experiencing COVID-19 related symptoms, they should take and clear the COVID-19 screening assessment before they come to the workplace. This tool can be found on the Manitoba Health website. Hey Jen, so another viewer's question was, what are the requirements around the use of non-medical face masks in the workplace? Can you answer this question for us?
That's a great question. Thanks, Mike. The need to wear non-medical masks in workplaces can depend on whether physical distancing from coworkers and clients is easy to maintain or not. A risk assessment can help you determine this. For example, your workplace may require workers to wear non-medical masks when moving between work areas because physical distancing is hard to maintain. Non-medical mask requirements may also depend on the pandemic response level in your geographical area. Learn more about the Manitoba Pandemic Response System on the Manitoba Health website. It is also important to ensure workers are aware of how to fit, wear, and clean a non-medical mask. Employers should consider training on the use of a non-medical mask if they are being recommended in the workplace. These are some really great questions we've had. There is a lot of information that we have to follow. Another question is, how will I be protected in the workplace? What if I can't maintain 6 feet of distance?
Your workplace should conduct a risk assessment when determining the specific public health actions related to your workplace during this pandemic. Your workplace should do a workplace walkthrough and address the following. Develop a plan for various scenarios for workers in and out of the workplace, such as what to do if staff become ill while at work. Review all tasks performed in the business to identify any possible risks. Look at how services can be provided in different ways. Review the flow of work processes, workers, and customers through your facility to reduce contact between workers and customers. Staff should be trained on COVID-19, how the virus is spread, how to protect each other within the workplace. Employees, managers, and employers all have a role to play in reducing workplace risk of COVID-19. Your workplace should implement the proper measures to reduce the transmission of the virus, which we have talked about in this presentation. Due to changes in recent guidelines since this recording, Manitoba Health notes if you cannot maintain 6 feet of distance within the workplace and exposure is greater than 15 minutes, employees may wear non-medical masks to prevent respiratory droplets from spreading to others or landing on surfaces. Again, remember to check the pandemic response level, which dictates the requirements around the use of non-medical masks. Another question that came in is, can I send workers for COVID-19 testing? Are there any guidelines to follow?
Great question. Keeping up to date on current information from Manitoba Health is the best answer to this question. This can be found on their website. Manitoba Health has currently indicated, in quotes, unless recommended by public health, only individuals experiencing COVID-19 symptoms should go for testing. Individuals with symptoms are asked to seek testing as soon as possible once symptoms are present. Employers are asked to only send employees for testing if they have symptoms or if testing has been recommended by public health officials. This may be subject to change. Employers should also be aware of the Manitoba Human Rights Code's policy position on an employer sending a worker for COVID-19 testing. The Manitoba Human Rights Code's policy position is that medical testing to determine fitness to safely perform work may be permissible under the code if the testing is shown to be effective and necessary in the circumstances such as a pandemic. Remember, organizations have a duty under the code to accommodate people who are negatively impacted by COVID-19 test results, unless it would amount to undue hardship based on the cost or health and safety. For more information on this and other questions around COVID-19 and the Human Rights Code, please go to the Manitoba Human Rights website. Communication related to COVID-19 is a big part of helping to prevent the spread. Mike, how does someone effectively communicate to a worker who might not be practicing COVID-19 prevention measures?
Great question. One approach is to remind the worker that all actions have an effect on others in the workplace. When a worker does not follow prevention measures, this includes hand hygiene, cough etiquette, and staying home when sick, they are sending a message that this kind of behavior is acceptable. This erodes the safety culture of the workplace and also places other workers at risk, as they may feel pressured to copy that behavior. The basic message is that anyone in the workplace can be a leader and can influence others. The right conversation can help the worker feel empowered to influence things in a positive way and convince them of their moral obligation to their fellow workers. The worker needs to understand that they have a duty under the Workplace Safety and Health Act to protect themselves and their fellow workers and to cooperate with the Workplace Safety and Health Committee in carrying out its duties. Therefore, if the worker continues not to follow the employer's COVID-19 prevention measures, the employer may take disciplinary action. For the final question, are there any resources that you can recommend related to COVID-19 in the workplace?
This is a really important question. Manitoba Health has a very robust website. This would include up-to-date stats, resources, posters, etc. Also, Safe Work Manitoba has a new COVID-19 e-course and a comprehensive COVID-19 toolkit. Check out the Safe Work Manitoba website for more information at safemanitoba.com. And the Government of Canada website is also great for additional resources.
So that concludes our presentation on COVID-19 in the workplace. As we have heard today, safety and health is a responsibility of everyone in the workplace. If we all work together, we can help to limit the spread of COVID-19. If you have any additional questions, please do not hesitate to connect with Jen or I.
On behalf of Safe Work Manitoba, thank you for watching our virtual presentation and for all of the questions. We hope you were able to take away some tools and knowledge to better understand COVID-19 and the roles and responsibilities of everyone in your workplace. We hope this will help keep you, your coworkers, and your customers safe. In the coming days, you will receive an email with a link to a list of resources, Q&As, and a survey. You will also be able to view the complete recording of this webinar and share it with your colleagues. Please be sure to visit safemanitoba.com to view resources and take the COVID-19 best practices for a safe workplace training to learn even more about keeping yourself and your workplace safe and healthy. Thank you.